Today we will be teaching you about delegation. Delegation is not a task assignment. However, delegation is a problem-solving process. Let's take a look at the 5 rights of delegation. Remember the 5 rights. Use critical thinking and professional judgment when following 1. The right task. Understand the right circumstance. The right person. With the right directions and communication. And lastly, understand the right supervision and evaluation.
Alright class, so today we're going over the rights of delegation. Do we know what the right tasks are?
No.
Well, I'll need to be studying some more. How many rights of delegation are there?
5.
Correct, alright. So, what is the first right? Come on guys. First right is the right task. You're going to be delegating to somebody, you're going to be delegating to the UAPs. What can you delegate to the UAPs?
Bathroom.
Bathroom, yes. And so you can't delegate anything that needs a second. What is the second right? Right. Circumstance. Sarah, can you give me an example of right communication?
You need to tell the UAP specifics, such as what patient, at what time, and any parameters that need to be given for the task you're delegating.
Okay, so right supervision, what does this entail? You need to monitor their performance. You need to obtain feedback from them. If you need to intervene, do it if it's appropriate. You need to ensure that they are documenting appropriately.
Yo, UAP, let's kick it. 5 rights, baby. 5 rights, baby. Alright, stop. Collaborate and listen. The first right is proper communication. Gotta make sure it's done correctly. Finish like pro, clearly and directly. Will it work? Yo, I hope so. Treat her with respect and she'll grow. To the extreme, I rock the right with the handle. Light up the room and give them something they can handle. Task. Don't rush the task move. Be sure to take your patient to the bathroom. Secondly, report back to me. Anything less than the best facility. Love it or leave it. You better be safe. You better not be shy to task in this way. If there was a problem, yo, I'll solve it. Check out this nurse while she solves it. 5 rights, baby. Gotta have 5 rights, baby. Gotta have 5 rights, baby. Gotta have 5 rights, baby. Gotta have, now that we have the right person, the task kicks in, the adrenaline is rushing, quick to the point, you can't be faking, you're certified so there shouldn't be shaking, burning through the task, you're quick and able, don't go crazy, it's really that simple, add a hat to monitor the I.O., you're on a roll, so now it's time to go solo, rolling through your shift, yo, the task down, charting the flow, I'll be on standby, waiting to give a high five, did you stop? No, you pushed through, check on pursuing to the next task, I chose the right person and heading to the next right. Right is done. Yo, I continue to the right circumstances. Girls are not leaving you often lonely. The patient is stable, not sign as tacky. Fearless because you know it's in your scope. The RN will assess and you will be fine. Ready with the tall light on the wall. The patient is getting ill because it's close to flatline. Outcomes are predictable. You're just fine. You'll do this really well. Calling all your skills really fast. Jump into gear and slam on the gas. Bed to bed, this unit is packed. You're trying to get done before the doctors are back. The peace on the team, you know what I mean. They got your back and it's really on your team. If there was a problem, yo, I'll solve it. Check out the nurse while she solves it. 5 rights, baby. Gotta have 5 rights, baby. Gotta have 5 rights, baby. Proceed to the right evaluation. RNs are on the team just in case you didn't know it. Write down all my notes. task like vision and feel. Directed and informed delegation has some steps. We make it right so you won't quit this. Here and with the ace, so slice like a ninja, cut like a razor blade you'll pass. Use our info scram. If we give you a task, we'll be there with a hand. Keep your composure alone and take no excuse. Satisfied with your work, now let's reintroduce. If there is a problem, yo, we'll solve it. Check out this miracle, she solved it. Five rights, baby. Gotta have 5 rights, baby. Gotta have 5 rights, baby. Yo, man, let's do it over again. Word to your mother.
Michelle, wake up. You're in class.
Michelle, wake up. You're in class. What are the 5 rights of delegation?
Right task, right circumstance, right person, right communication, and right supervision.
Right task. Does the element of care fall within guidelines of policy and procedures, as well as the American Nurses Association Code of Ethics? Also, can the element of care be delegated to another staff member? Right circumstance. Does a delegate have the available resources, equipment, safe environment, and supervision to complete the task correctly? Right person. Does the delegate have the education and competency to perform the element of care? Right direction or communication. Are you being clear and concise with the description of the task, including its objective, priority, limits, timelines, reasons to report, and expectations? Do you allow for clarification without the fear of repercussions? Right supervision and evaluation. Is there appropriate monitoring, intervention, evaluation, and feedback? What went wrong or right? What could have been done differently to achieve the desired outcome?
I don't even need to know this. 5 rights of delegation. Blah, blah, blah. Ooh, Fresh Prince of Bel-Air's on.
This is a story all about how the rights of delegation turned my life around. And I'd like to take a minute, just sit right there, and I'll tell you how I became the Delegation Queen of Healthcare. In nursing school, I was born and raised on the unit floors where I spent most of my days, chilling out, maxing, working all school, and volunteering to give bed baths just like a fool. When a couple of new grads who were up to no good started delegating tasks not like they should. They got in one little bind, and the board got scared and said, "You have to learn how to delegate to succeed in healthcare." Signal for my UAP, and when she came near, I delegated the task, and she had no fear. If anything, I could say that she was prepared, and we made sure that the patient received the best care. I used the 5 rights, and it turned out great, and I evaluated the delegate and said, "Yo, home is way better." Looking at the situation, I was finally there, and I mastered the right delegation of healthcare.
Just remember, as a delegator, you are accountable for your own acts, delegated tasks, proper supervision, assessment of the situation, follow-up, intervention, and client outcomes. And as your delegate, you are responsible for your own acts, accepting the delegation, appropriate notification and reporting, and accomplishing the task. Here are some reasons to reconsider delegation. There may have been a change in your client's condition. Work may not have been completed that was assigned. Failure of the delegate to report. Delegation reluctances to avoid. The I can do it better myself trap. Lack of ability to direct. Lack of confidence in other staff members. Lack of confidence in self to delegate. Fear of taking risks. Need to feel in control of difficulty situations. Fear of losing authority. Why your delegates may avoid responsibilities. There may be a fear of criticism for mistakes. A lack of clarification on what or why something should be done. Overwhelming workload. Lack of self-confidence. And delegators' responsibility and individual preferences may interfere with delegation process.
When delegating, a nurse must have a positive attitude, determine what needs to be delegated, select the right person for the right delegation, communicate what their responsibilities are, grant them authority, be available to provide support, monitor the delegation, evaluate the delegation, and do the proper assessments before making the decision to delegate. Before delegating, ask yourself, is there a potential for harm? If there's a potential for harm, do not delegate. How complex is the task? The more the complexity, the less desirable it is to delegate. How much problem solving and innovation is required to complete the task? If the task requires a nurse's judgment, innovative approach, or adaptation, do not delegate. Could the outcome be unpredictable? If a patient's outcome could be unpredictable, do not delegate. Will delegation decrease or increase the amount of time the RN can spend with the family and patient? If it decreases the nurse's time with the patient, do not delegate. Thank you for listening to our presentation on proper delegation.
You're not filming yet, right? Set, go.
When do I do this?
Sarah.
We're going down at the same time.
Get the beat down. Y'all are not on beat.
Yeah, we sure aren't. Doesn't matter.
Me and Stacy I'm just playing with Shelby.
Y'all are not going up here.
Shelby, keep pushing me.
Okay, go that way.
Because you're keeping me on beat. Ready? Are you filming?
Yeah.
Ow. Shoot.